I'm with the State Bar of Wisconsin, and I have the privilege of being the director of the Professionalism and Engagement team. I'm sure many of you know the folks that work on that team. Today, we have the opportunity to share information with you about our group health plan for law firms. Those who have checked into the group plan have decided, many people who have checked into it have decided it is a very cost-effective way to offer health insurance to attorneys, staff, their families. And we are fortunate today to have with us one of the administrators of the plan, Christine Nadolski. Christine is with the Professional Insurance Programs. And since she works with the program on a daily basis, she's in a great position not only to share information with you, but answer any of your questions. I wanted to just mention that you can feel free to ask questions anytime you have them. Raise your hand, and we have someone in the room that will come with a microphone so that the question can be captured. We are video recording so that we have the benefit of sharing those questions with others that will be watching this later. So without any further delay, I will turn it over to Christine.
Thank you, Annette. We appreciate our relationship with the State Bar. We obviously treasure it most definitely because it is a very special one. Today, I bet you didn't expect to have a quiz so early in the morning, did you? I know I'll let you get your coffee. With a show of hands, how many people offer paid group health coverage? If you haven't, have you considered the State Bar Group Health? If your business is based in Wisconsin and you have at least one other full-time employee that is not a spouse, you are able to offer group health coverage. The nice thing about it is that you don't have to pay premium if it's stretching your budget. You can do a stipend, but I will get more into that when I get into the program. I read an article the Thursday before or Wednesday before I left. Are you hesitant to offer coverage in a small firm? If so, you're not alone. According to recent surveys, there's about 30% of small businesses who offer very limited coverage, if any at all. And it's due to high costs. If you've ever looked into health coverage, the Affordable Care Act plan is age rated. So if you're 50 and above, you're going to get dinged pretty hard. So if you're on the fence about offering that health coverage, here's 3 solid reasons a quality health insurance program could actually help your bottom line. Health insurance can actually help recruit and retain valuable employees. I hear this over and over and over again every day in conversations. I lost an employee three doors down because they offer health coverage. Well, you can do the same. I mean, you can offer and add value to those employees by offering that. You can also make your employees healthier and more productive. The worst thing in the world is when you're set against deadlines and all of a sudden your employee who you're counting on, who's your left hand, right hand, every hand, calls in sick. And you're like, okay, now what do I do? And you're scrambling to try to find somebody to help you with all of your stuff that you have to do within a half-hour time frame because everything is on a time limit. So if they're more productive and they're healthier, they're going to be at work and they're going to be more productive for you. There's also tax advantages that tie into employer-paid health insurance. Your bottom line is health insurance really does pay off because the more productive you are at work, you're keeping your doors open and you're making more money and you're retaining more clientele. So definitely something to think about with the health coverage. Now, digging in a little deeper to our State Bar health plans for law firms. Again, my name is Christine Nadolski. There I am, a long time ago. And I am the team lead benefits, or team lead for the benefits department. I've been with professional insurance for 17 years. They're my family. And as you know, if you've been with a company for a long time, they really do become your family. They really, everything you do, they've known my son from 5 years old and now he's getting married. So I'm like, oh my goodness, it's a great thing. Enough about that though. The agenda for today, we're going to actually overview the types, plan types and the common terms, plan designs and the benefits of the plans, including many value adds that are included in your health insurance without any additional premium. And then the quoting process. How do you get a quote for these said products? Well, I'm here to tell you all about it. The different plan types that we have two different plan types really kind of in the insurance world that are fully insured. It's a copay plan that has a set predetermined amount when you go to the primary care provider, when you go to a specialist, and then for your prescription drug plans and urgent care as well. The other type is a high deductible health plan, and that's just exactly what it is. It's a high deductible health plan that actually all your services will go toward your deductible and co-insurance before the plan starts paying any of its benefits. Now, with both of these options, your preventative care, if you are in network, will be 100% paid by the carrier. Your mammograms, your pap smears, your annual physicals, your colonoscopy, keep in mind that if there's anything found, then it will go toward the procedure role. I can't say that word, but it will be put toward procedure or coded as procedure, and that will actually go toward your deductible. All right, so now we want to go into a couple of terms. Oops. There we go. A couple of terms that we do get questions on a regular basis. Deductible and coinsurance. They're very confusing sometimes for some people, but the deductible is how much you pay before your health insurance starts to kick in for a larger portion of your bills. Your deductible, regardless of when you renew your plan. So if you wrote a plan, say in May, and your renewal is always May of the following year, that is your plan year renewal. Your deductible starts over every January 1st. Now, if you are coming from a prior group product and offer coverage off of the anniversary of January 1st, you can get a deductible credit report to apply to your current deductible. A lot of people don't know that. I've already satisfied my deductible, or I have half of my deductible already taken care of. And now it's just gone. No, we can have WPS apply that. Coinsurance is actually a percentage of medical charge that you pay, with the rest being paid to your by your health insurance plan. Typically, the coinsurance applies after the deductible has been met. A lot of the plans you see are kind of 80-20, and like, okay, what does that mean? That means you are responsible or cost sharing for 20% of the charges that are applied to coinsurance. The carrier would pick up 80%. Sometimes those are a little bit intimidating, that is for sure. With the Association Health Plan, we have 9 different plans for your firm to choose from. Now, we have 4 copay plans for 2023, and then 5 high deductible health plans for 2023. The one that I want to point out is the new high deductible health plan is $7,500. This is a new option that we had offered, brought in for 2023. With the rising cost of health coverage, we wanted to make sure that we had a deductible that brought in a little bit lower premiums, so you feel a little bit more comfortable offering. Now, say you have a firm that has 4 people in. You have a mom who has kids who's running to the doctor every time they're sick. It happens. A copay plan might be better, because you have a $25 copay for those primary care visits that aren't preventative. If you never go to the doctor, only for your preventative, and that's it, and you're healthy as an ox, and you're like, okay, I don't need health insurance, I self-insure. Maybe that $7,500 deductible with the health savings account might be one of the better options. It's going to bring you a lower premium, but it's also going to give you a cap on what you're going to pay out of pocket, just in case, knock on wood, something were to happen. We can't control everyone else out in the world. We can't control when we walk across the street going to our next client that you're not going to be hit by one of these crazy drivers. So we will always want to make sure that we have some type of coverage so we don't have astronomical insurance bills that come up. The next thing I want to talk about is your plan selection. Again, you can offer up to 4 options with one carrier. Now, when I say one carrier, it's because the association plan has WPS Health Insurance, which offers statewide network, which is a very robust network. And it also offers WPS Health Plan. Now that one, you can actually do it's called a POS, point of service, or an HMO provider. And it has a select care network, which is a smaller network, but also kind of reduces that premium a little bit more for you as well. Both of your plans, whether it's health insurance or health plan, will offer out-of-state coverage through First Health Network. So if you have kids that are going to school, you're traveling with the family, something happens, rest assured they will have coverage. Yes, ma'am.
So I have a remote component.
Oh, sorry.
So one of the things that happened during COVID is some of us started hiring remote employees. So I have someone who's always going to be out of state.
Yep.
Am I able to get that person on a group plan?
Absolutely. And that's a fantastic question. As long as you are domiciled in Wisconsin, you can have as many remote people anywhere in any state because they'll have First Health Network. You would have to be here, correct? Right. Absolutely. And that's a fantastic question. So again, this gives your employees flexibility when electing a plan for themselves or their family. Employer contributions. Now, this is a big hit for a lot of small employers because the Affordable Care Act requires you to pay 50% of your single employee premium. That's a big hit sometimes. So with the association plan, we suggest at least 50%. But you can do a stipend, like I had said earlier. You can pay 0%, you can pay 100%, and anywhere in between. It is up to the employer on these plans on what contribution levels you can fit in your budget. And again, you're still offering benefits, which is amazing in itself. And if employees want to take it, they can certainly do so. Full-time employees are not at 30 like the association health plan. When we created this plan, we know, and from other associations, that not everybody works 30 hours. So we wanted to reduce it to 26 hours so we could offer coverage, or you could offer coverage to those people who don't quite fit in that 30-hour range. If your employee handbook, if you have one, says it's 30 or 32 or whatever, of course that's going to supersede what we say. But it's nice to have that option. Customer resources with WPS are amazing. If you are insured with them currently and you go into their member portal or their employer portal, you have convenient online access to tools and resources, libraries. You can access health information, wellness information. You can look up your claims, see how much your deductible has been met. So it is unbelievable. They have a symptom tracker on there. So if you think kind of like WebMD, like, I have this and this and this, and it's like, okay, wait, what could it be? It'll give you some very intelligent information. half the time with WebMD, I have, I don't know, some type of life-threatening disease. So more benefits of the plan. We do have a prescription drug plan underneath the large group, because it is underneath the large umbrella of the state bar. There are $0 copays for preventative drugs. This helps manage chronic conditions more effectively. There's also a comprehensive list of common medications to treat asthma, depression, diabetes, high cholesterol, blood pressure, and so many more. And this includes generic and brand name drugs. So we do have a list of that. And if you need that, reach out to Annette and I will get that over to her as well. And I'm sure she does have that as well. Preventative services, I touched on that very, very lightly. WPS will pay 100% without cost sharing if you receive in-network services from providers. Routine immunizations, routine medical exams, diagnostic services, well baby care, mammograms, and preventative screenings. Now, if you are on, and a heed of caution, if you are on the WPS health plan, you have to go to the select care providers. It's not the big network like the statewide plan. So that's more of the Aurora, the Bellens, those type of providers. And we do have tip sheets as well that we can get out to you guys. One of the wonderful no-cost value adds is telehealth services through Teladoc. Like your remote person who doesn't want to, might be sick and is working at home and just doesn't feel well, she can dial up Teladoc and she can have an online diagnostic service. They do general medicine, mental health. Mental health is so important these days, more so now than ever, especially with COVID. People are trapped in their homes. They're not getting out. I see it within my mom. And I mean, granted, she's 87, God bless her, but I can see a lot of mental health issues happening, even from people that I talk to. Mental health, anxiety, stress, depression, marital issues, because you locked up with your husband or your wife for how long, not feeling like yourself, and so much more. You can have Teladoc services for $10 or $90 with the high deductible health plan for a therapist visit. Dermatology is something new as well that they have brought on for acne, psoriasis, emphysema, skin conditions, and so much more. Take a picture of it, send it over. They can, if the picture's good enough, they can diagnose it and start a treatment plan for you. Okay, what is next? Oh, this is a good one too. Oop, I think I went too far. No, I didn't. I just have this out of order. I apologize. Fumbleina. All right. The iMed Vision Discount Program. I utilize this all the time. Obviously, having glasses. I go to Wisconsin Vision, which is a part of this provider network. It is not an eye program, like a insurance, but it's a discount program. So it includes LensCrafters, Pearl Vision, Target, Optical, and a lot more. You can get routine eye exams, laser vision correction, and glasses at a discount, which is really nice. Hearing Care Solutions includes a comprehensive hearing exam, hearing aid fitting, discounted pricing on hearing aids from 9 major manufacturers, and also a 3-year warranty and 3-year supply on batteries and non-rechargeable devices. So no one can ever say, what, I didn't hear you, because you know what, they have this benefit. Pulmonary Care Program is actually a newer program as well, and it's helped to manage asthma and COPD with the rising diagnostic of these type of conditions. This includes a sensor for your inhaler and a mobile app. It does track your daily usage, so then that way it can provide you tips to breathe better. It encourages compliance through reminders for medication. And then if you lose your inhaler, I mean, what kind of panic is that? It will actually help you find your inhaler, which is nice, and it gives you summary reports. Diabetes care program through WellDoc does the same type of thing. It manages your prescriptions, reminders. It has a connection data for food, weight, activity, blood pressure, sleep, and more, because we know it's important to obviously eat a healthy diet, get your exercise, get good sleep. Provides individualized real-time feedback and suggestions. And what's nice with some of these too, that your provider might even have access to a lot of this information through your devices. So it kind of acts as a diabetic coach. And smoking cessation. This is brand new, which is wonderful. We all try to kick the habit, and thank God I kicked the habit many years ago, right before I did a 60-mile walk in Chicago, obviously not with this knee. It was a newer knee. But members 18 or older can actually have up to 180 days assistance annually. It does include a tobacco cessation visit that you do have to do. But it also provides nicotine replacements over the counter, like the patch, gum, lozenges, or prescription inhaler, and also some non-nicotine replacement drugs as well. All right. An exercise reward program for those who like to get out to the gym and really hit those barbells and treadmills. If you go 10 times within a month, you can actually get rewarded for it, $30 a month from WPS. You do have an ASH Connect mobile app that you can log your progress. You can do a paper log and email that or mail it over to WPS. And a lot of times your fitness centers will actually track that for you as well. If you're enrolled in the Active and Fit, which goes directly into the next product here, that will automatically track. And the fitness center membership, it's a discount, and it has over 12,000 standard centers and 5,200 premium fitness centers. $25 fitness fee. Obviously, the premium centers do have a buy-up cost, and it transfers from one participating facility to another. So maybe you're at the Elite Club and you said, oh, you know what, I really want to go over to the WAC. Not a problem. It'll transfer right on over for you. So how do you get a quote for this marvelous plan that we have put together for you, our members? We do have census forms available on our website. You can email our website directly as well, request information. You can contact us directly. Our business cards are right on our table over at our stand here. And definitely visit us. Wendy is over there right now holding down the fort. So once you fill out that census form, you want to make sure it's complete with the people who are going to be on the program, because your census will dictate your preliminary rates. So if you have 10 people listed and then you figure, well, only 5 are going to take it, I mean, we'll rerun the quote for you, not a problem, but rest assured that your preliminary rates will change with that count. Which leads us into the next one. When you request a quote, we'll have it to you within 24 hours. We are very confident in that as well. That's one of our promises. We quote it right from our desktop and we can get that over. Sometimes it's even within the half hour on good days. So now you want to see what your final rates are going to be. We'll send you with your preliminary rates. We will send you an application for your employees to fill out. This is a medical application. Please list everything that you are being treated for, as far as the time frame on it. The last thing we want to know or want to do is say, well, this person might not be as, honest as possible. Yes.
So with HIPAA, does the employee send that directly to you, or is someone in my office responsible for that paperwork?
And that's a great question, because not everybody wants their medical information out. Your employees can scan and email it to us. They can send it via mail. We do have a secure fax as well. So however you feel most comfortable doing that, and HIPAA is huge. So we do have a lot of firms who do have their individuals email it directly to us. Again, it's your preference, most definitely. Just make sure that you have the name of the firm on the application somewhere so we know where it goes. That's the biggest issue that we have. So once we get all of the information for underwriting, the applications, if you currently have a group plan, we would like to see the last invoice for your carrier, your quarterly wage and tax, or your UC 101 that lists out the employees, because WPS needs to know that you're a true firm. We'll send everything to underwriting. About a week's time, now getting in further to the fourth quarter, it may take a little bit longer because underwriting is starting to get a little swamped. They will send back final rates. We send those to you, and if acceptable, we will send also a group enrollment form as well with the rate sheet that would need to be signed. We would have that group enrollment form completed with assigned rates, and that's your acceptance. You don't have to send in an initial premium check. You can do automatic cash handling, and they will take it right out of your account when everything is issued. And really, you can establish a group at any time. So if you get a renewal on your current plan and say it's March and you're like, whoa, what is happening with this? Contact us. We'll be more than happy. We're finding that with the rating tool that we have with the State Bar program, it's a composite rate. So it takes a blended rate of everyone on your census and provides you with rates. Now, again, like I said before, Affordable Care Act rates, if you're, 50 and above, those can get pretty pricey, and they charge per child. So if you have 3 children, you're paying, and then the older they get, the higher the premium goes. With composite rating, what happens is, again, they take that blended rate. You have one rate for all of your single employees, one rate for your husband and wife, or partner and partner, or parental unit and child or children. They consider that limited family. And then your family rate. And family rate, like I was telling Annette this morning, you could have 1, you could have 20 kids. It doesn't matter. As long as you have a child on your family plan, it's going to be a family rate. So definitely something to think about. And it really helps to reduce that cost for employers when they're looking at composite rating as well. With that, I comes to the conclusion of me babbling. So thank you. Thank you so much for having us here. We are so honored to be a part of your conference and be partners with the State Bar. If you do have any questions that you think about throughout the day, throughout the weekend, when you get back to the office, definitely take a screenshot. This will be also, I believe, on the next presentation, Zoom. Info at profinsprog.com. That's short for Professional Insurance Programs. There's our 800 number and our website, and we would love to answer any questions. Yes, sir.
I may have misheard, but is an attorney that has no employees that would like to be on the insurance plan eligible? Just a single
That's
person?
a wonderful question. And unfortunately, because it is a true group product, we would have to have at least one person waiving or declining the coverage that worked 26 hours. So the true solo attorney would not be eligible because they don't have that one person that would be waiving off. Now, we do offer individual coverage. We do not work on the marketplace. We're not going to fuss around with all of that. But we do offer individual coverages that are also on the marketplace. You just don't get a premium credit.
If I have an employee and he declines, then I'm eligible.
Absolutely, you are. Absolutely. Yes.
So I hear about open enrollment beginning November 1st.
Yep.
And I'm wondering if that has any impact on my decision to transition or shift over to this kind of a plan. And then I have a follow-up after you're done.
Okay, thank you. And that's a great question because you hear about open enrollment all the time. Open enrollment for Medicare, open enrollment for healthcare. With the group plans, you can establish at any time. So essentially groups like to do January 1st because maybe that's when their plan renews and they know what their potential rate up or renewal is going to be. And everything starts over January 1st, your renewal date and your plan year. But it's not necessary. If you say, you know what, the one thing I want to heat on that though, if you started up for November or December and you have services going to your deductible, it will start over January 1st. So that's one thing that I always kind of caution. But if you can hold out and wait till January 1st, absolutely. Absolutely. Anytime.
And then I have a follow-up question too.
Yes.
So what timeline should I keep in mind? If I want coverage in January 1st, when do I have to have everything, my rate quote requested and my ability to actually look at things and make a decision? What is that timeline and when do I have to have everything submitted?
Perfect question. Definitely. We prefer to have everything in on the 15th of the month for the first of the month, following month. As far as quote rates, if you want to see what those rates are, send us your census as soon as you possibly can, which is wonderful because we can work on it. That gives you more time to review, ask questions, find out what the ins and outs are, get applications back to underwriting. Because again, they get a little bit bogged down right now. So we want to make sure that we're giving them ample time to review. And of course, yourself ample time to say, you know what? Yes, I want to go with it. No, I don't. You know, what can we look at? But rule of thumb is the 15th of the month to have all applications in. So then that way, come the first of the month, you have your ID cards and you don't have to worry about it. We try to send out the temporary ID cards as soon as we get them, and I always request them for groups. We do have a lot of groups who submit the last week of the month, but we get it in. We do get it done. So that's a great question. Yes, sir.
One more, sorry.
No, don't be sorry.
As you know, many people look for a couple quotes and kind of compare and see what works best for their situation. Can you kind of speak in general about how the rates are competitively in the marketplace?
Absolutely. A couple of years ago, actually, WPS had really looked at the association Group Health and said, you know what? We're looking at it and assessing it according to like the Affordable Care Act plans and the individual plans that are out there. And they did some rate adjustment. So they did knock down those rates, which is wonderful. And we had a lot of enrollment as well due to that. When we're looking at the Affordable Care Act rates compared to preliminary rates, ours are coming in a lot better. Most definitely. Even individual plans on the Affordable Care Act, we're finding that our rates are much more competitive in a lot of instances. Of course, it depends on age. It depends on where you're at. But for the most part, we're right in there. Definitely. A little bit lower. We're sliding in. Are there any other questions? Yes, ma'am. That's okay.
So even though it is a group plan, we still have to get all the medical history of all of our people that are going to be on it.
We do. And the reason being is because this is actually underneath the large umbrella of the state bar. So it's considered large group, even though it's your firm. It's kind of the combination of all the members that are within the state bar that are enrolled fall underneath the large umbrella. Now, the Affordable Care Act, it's guaranteed issue, so there's no underwriting. With this one, because it is considered large group in a sense, there would be the underwriting that would be involved.
in your premiums. Is that what you're saying?
Correct. So
Okay.
the best scenario would be our preliminary rates. And then once underwriting reviews everything, then it could, depending on the medical conditions, the prescriptions, the cost of the care for whatever condition may be, will determine what the rate up would be for that group.
So that rate up thing, is that the annual review? So like you might give us your preliminaries now and we go, but then at the end of each year, we have to submit something again to you with everything, and then they
No,
keep
not
going?
at all. How it works is, okay, I give your preliminary rates to you. You send in those applications with all the medical, underwriting reviews it, and before the group is really finalized or has final rates, they actually send that information over. Now, it could be the same with a zero load if there's really nothing that kind of strikes out as something that could be a potential costly condition.
Yeah.
It could be a 10% load on top of those preliminary rates. And that's where you would really work with us and kind of look at the rates and say, okay, this plan option is a little bit high. Why don't we look at putting, Susie Q over here on this one, and somebody who doesn't have health issues, they can go, with a high deductible health plan. There'll be a rate rate line on the bottom, signing, which is your approval. So those are your rates for the entire year. So your renewal will actually come, I want to say 60 days before your anniversary date. So if you take it out January 1st of 2023, your renewal will be January 1st of 2024. There are no re-entry applications that you have to do. They will send a complete renewal out with all the stipulations and guidelines and Wisconsin mandates and what have you. And that's when we contact you and say, how's it looking? Did you want to make any changes to it? Are you happy with the plan? How can we tweak this for you to make it a little bit more accommodating for your firm?
So I guess I understand that they would know what what medical treatment your people that were enrolled in would be because they had you for the year.
Right.
But like, what if you got different employees or people went on and off? Don't you need their data at that transition point, or
And
how does
that's
that work?
a great question, because I have a lot of people who, do I need to fill out the medical questions for somebody who's a new hire? Since your plan is already established, you do not have to have medical questions answered. So it's really bizarre. And I'm like, okay. So any new employees coming on, any spouses coming on, they don't have to answer medical questions. Of course, when renewal time comes, it may reflect any conditions that may be on that. But they kind of have a nice enrollment. They can just say, oh, here we go. Here's my name. Here's everything I need. And no medical questions at all. So that's a great question. I question that myself. And I'm like, we really don't have to do that? And they're like, nope. I'm like, all right, you're the company. So any other questions today at all?
No, we have none. For those of you watching on the web, certainly you have the contact information to be able to submit your questions. And, Christine, thank you so very much.
Absolutely. Thank you, everyone. Have a fantastic seminar. Enjoy.
And I wanted to just thank Christine. I also wanted to just throw in one more point here. In preparation for sharing more details, and as people are thinking about healthcare and maybe changing to a different plan, we did find some information out there that Kaiser Permanente did in terms of analyzing increases that are taking place. And over 50% of people that are getting their healthcare through their employers, those employers are going to see anywhere from a 5 to 14% increase taking place during this next renewal period, largely because of inflation and utilization. During the pandemic, we weren't able to actually go and take the treatments or appointments that we normally would. And now, as a result, when the floodgates have opened and everyone is back doing those kinds of things, that's where the utilization is increasing those rates. So given that the employer market is going to be seeing that kind of an increase taking place on premium rates, hopefully this will be an incentive to maybe check into looking at the group health plan. And I know a lot of people that have switched over and gone into the group health plan have been really happy with the premiums and with the flexibility to make adjustments. And I think the other key takeaway is this isn't of those 9 designs that she had in her slide. It isn't a one size fits all. It isn't pick one. You can have several that you offer to your employees, your attorneys, their families. And so they have some flexibility then in finding the right plan to cover their needs as well. So if you have questions, feel free to let me know. Again, my name is Annette Ashley. I'm happy to help with anything that you might need. Christine, though, is the one that really does work directly with WPS and can answer more of your questions. And we're glad that you're here, and have a great conference. Thanks.